couple people recorded me for like 30 minutes. Like they kept coming by and videotaping me. So I figured, I was like, this isn't a huge campus, so I feel like that's gonna be around somewhere.
Yes.
I was like, it's pretty. I've noticed any little tiny thing, it's like it just like the telephone, it's just like all over the place.
We do
I
have.
end up on Fizz because everybody on Fizz.
Yeah.
I knew it was on Fizz. Yeah.
That's funny. That's cute. I like that.
I was like, oh my god. I would
That's
never want to end
hilarious.
up on Fizz.
Fizz. What is the Fizz? The social media for the
It's like
school?
anonymous social media. Yes.
Really?
Oh, really?
Yeah, everything.
Oh, boy.
Like the BS.
Oh, that
Yes.
anonymous part, right?
Who's presenting first? Because we're for
I'll
efficient.
do it because nobody's in here. Okay.
Because nobody's in here.
Yeah.
Take advantage of it. It might be in about, you got 20 minutes.
Because if we're efficient, and people still have registration questions and all that, we can do that before the AUP meeting starts.
What is that?
It's your thing.
University professors.
Oh,
Oh.
what time is
that?
It's probably like 3:45. Because I'm vice president.
Period. Who's president?
Dr. Shaw.
I don't know who that is. It's
Dr.
okay.
Shaw.
I've seen this.
I don't think they
name
matter.
Dr. Brennan Shaw, they don't matter.
Everyone matters.
Not if I don't know them.
Do you want a PowerPoint up there?
Yeah, I mean,
You
why
do?
not? It don't
You want
matter.
it?
Listen, I
on
don't
the
care. I'm just trying to
computer?
get my stuff over with. So,
I mean, if you want to just go, you go. But if that
yeah, you can just put it on there.
requires this or that or these, what do you need?
You just look at PowerPoint and I'll log into it, or
Is
I
it?
don't do that.
Oh,
You can also share.
Or you, it literally
That's an
should be your
idea.
thing. I submitted it.
I know, right? I was gonna say I can do that, or if you can log into your own Google here. Is it off Google Slides? Just log in and you got it.
It says that the Biden administration just canceled another $6 billion in student debt.
Right. Well.
That would be nice if it affected
Right.
me.
Right.
So, wait, what am I supposed to be doing?
So is it on your Google?
It's on PowerPoint. Well, obviously, I log into my PowerPoint.
Yeah.
So,
Is that
PowerPoint.com.
you can log in
You
here?
can log
if
directly in.
You want to? I'm just trying to think of ways. Oh, life happens.
I added the, because I forgot to add it to my original slide, I didn't realize I needed a citation page, but I put it on there just because it's all from the DSM-5.
Okay.
I didn't go outside of it really. I had one link where I asked it to rephrase, and I used the American Health Association to rephrase the definition so I could get another perspective that I kind of added in there. But besides that, it was purely my own communication along with DSM-5.
Okay.
I just read like 30 pages of it,
It
digested
is.
what I could.
It is
It's a big document.
crazy. Is it signing me in or you in? That's
I'm signing myself in.
okay.
Oh, wait. I just pushed add another account, so I'm waiting. Sign in with a different account. I don't know if I would have to sign you out to do that.
So it says course name / number. One
Practice
number.
3 and it probably does. one.
4203?
Probably that's one, but the other number is a 5-digit off of the registry.
The 51578.
Probably.
Okay, I did that one first. Okay, well.
And that's
I
called
assume
like
that-
a
I hope they-
special number.
I hope that they.
Sometimes they do. I feel impressed what they do figure it out because if it was up to me, I would feel confused.
Hey,
Yeah.
welcome.
Oh, you shut up.
Oh, what? Dang, that's messed up.
I told you before.
Some friendly harassing, right?
Yeah,
Give each other a little bit of shit.
it is kind of funny.
This morning, dude, that one of my classes this morning, that you guys know Mr. J
Yeah.
in the business school. he'll straight out. He's not afraid to be like, well, where have you been? Oh, yeah, came in 15 minutes left in class, huh? Are you sure you want to be here?
His wife called me out this morning.
Did she?
I had to go to her for a meeting. She was like, "Oh, this your first time in weeks seeing me, ain't it?" I was like, "Stop playing." I seen you like a week ago. She like,
That's
"It's been like a
hilarious.
month."
Dang.
That's funny.
It says do not use your social security number.
Okay.
Right, like.
Probably, yeah, probably good.
And that
I did this
I
one.
had to add that because someone did it.
The other day, so. Why are you making us do this? This is ridiculous.
Because you will be on your point game forever.
I sat down when I did mine.
I did this while I just don't like being in front of people. Okay, I did this while I was half asleep, so I decided to do OCD. So.
You're not supposed to admit it.
Well,
You
because
did this-
considering I submitted it at 2-something in the morning, you would know that I was half
You
asleep.
got a baby. You could be awake at all times.
Right. Okay. So I said, "What is it?" And look at my block person.
I love
I
it.
said they're compulsions that interfere with daily life or excessive thoughts that lead to repetitive behavior. And yeah, I don't think I'm gonna make it to full 12. Let's hope my video does me justice.
The videos.
So I said, what causes it? And it says experts aren't sure of the exact cause, but it can be genetics or brain, I can't say that word, or an environment. It usually starts in the teens or early adulthood, which is, is definitely, yeah. Not a good thing though. Not a good feeling. So it says, what are some of the symptoms? So it's fear of forgetting, losing or misplacing something, or fear of losing control over one's behavior. And I can say, well, obviously you can see it. Unwanted, forbidden, or taboo thoughts involving religion or harm, desire to have things symmetrical and perfect ordering or arranging items in a particular precise way, repeatedly checking things such as the door is locked or the oven is off, and then compulsive counting and praying or repeating words. So I think I do the third one, the fifth one, and the sixth one.
So, is it the 5 out of 9 you're thinking?
That's
how you diagnose it. Is it 9, 1, 2, 3, 6?
Oh, I probably
Also-
forgot. No, I deleted one of them because I couldn't fit it on here.
Okay.
So if these behaviors cause problems in your life, biggest thing.
Yeah, they do.
You think? All right. Well, all right.
It's gotten better though, but
Okay.
and it says how do you determine, these are just questions that you would ask. So it's do you experience unwanted thoughts, images, or impulses that repeatedly enter your mind despite trying to get rid of them? Do you ever feel driven to repeat certain acts over and over? And does this waste significant time or cause problems in your life? Ariana's not presenting today. She's not gonna be here. And I said things that can make it worse. What?
Is it on there? You said.
It's on here.
Oh, okay.
And what makes it worse is I said Ariana's not gonna be here.
I thought they wrote on the.
Oh no! She
Okay.
just texted me.
I also thought that.
Okay.
No. Oh, and it says our underlying health conditions: stress, abuse or trauma, isolation, improper diet, poor sleep, and whatever that last thing is, ruminating.
Bad self care. Yeah.
Kind of obsessing, basically. Rumination.
And then it says what makes it better. Treatments. It's you could do talk therapy or medication or both. I don't know what those medications are, but I would not want to do antidepressants.
Probably like Wellbutrin. Yeah.
I heard that antidepressants can make you more depressed.
So
It depends. Yeah, you all react different.
Inhibitors.
You all react differently to medication. That's why it's up to your doctor.
Yeah, my doctor, she was like, do you want to do this? And I was like, no. And then therapies use their support groups, cognitive behavioral therapy, aversion therapy, psychoeducation, and more. And then this is a video that I was watching here. I'm going to turn it on because it was pretty good. It's not that long. I made it short for you guys too.
Okay.
Or we would just watch it like that. This is not it. They're going to talk.
When I would go to bed, I would have to fix my curtains not just once or twice, but like 10 times, a lot of times, more than that. So it would take me about an hour to go to bed.
Most of the rituals that I had, they all had different meanings behind them. But one of the things that I had to do is could only wear certain clothes, and if I wore another shirt or another pants, I would it would just say something bad would happen to like my family or friends.
I had a lot of contamination fears. I didn't like to touch door handles, shake hands with other people, just in fear that I would get sick or catch a disease, or that there would just be germs all over me. And I could transfer it to my family and friends. Sometimes if I saw something that I'd never seen before, I would still like find out what's not right about it, and then I'd basically find a way to like annoy myself. I'd find a way to hurt myself and be like, oh, that's not perfect. Don't look there. It's gonna mess you up, and it'll like, or I know it'll like something bad will happen to it, or something bad will happen to me if I keep looking at it, or something. And I was like, it came to the point where I was like, if it was like I kept looking at something bad, I was like hitting myself and trying to like just not look at it, like run away or something. It wasn't very good. I knew all this stuff was fake, but it was hard for me to say no and stuff. So I knew that it wasn't gonna happen, but like I know that it's unbelievable that I'm just gonna poof and I'm a bodybuilder, but it's just so real to me in a way.
I think that's it. No, I know that wasn't the longest, but then again, I told y'all I wasn't gonna be up there long, so.
Good.
But I don't think there should be any questions unless somebody does have any questions. But
Questions, comments, thoughts,
Did amazing.
ideas?
thank
Did
you.
amazing.
I try. I don't.
See?
Did
Can
amazing.
you pull up my slideshow? I submitted it.
Probably.
I'm not gonna be here.
Who else was presented today? I'm just trying to.
Ariana was, but she's not here.
I can go today.
Okay. I think I did just get yours. Let me see here. Oh, Tuesday the 26th is next week. Okay. See if I can put myself off screen. How about that? That's always fun. And I'll do a D2L for you guys. Is everybody else hanging in there for the semester?
Yep.
Every single class?
Try it.
Passing them all? Huh?
Is anybody else thriving?
That's good. That would be good.
I do every class, but astronomy because I'm not good at astronomy. And all the answers are on Quizlet though, so it's not like I'm bad at it, but it's just too much. Now I know you're not supposed to admit to cheating, but you know I'm not interested in astronomy, so.
Oh, I didn't know astronomy is
I didn't know it was a lot.
They got it, yeah.
an option.
I just did it because it was online and it got to do with space and all this other stuff. Yeah,
Let me find your stuff.
Ariana said she'll present Tuesday.
Okay. Is that when we have that big thing everybody was talking about? Oh, I only have 4 of you guys, right? 4, 3,
Oh,
2,
wait a
1. This one?
Sure. Okay, so you made me log into PowerPoint instead of just pulling mine up. You made me log.
That's how you got your 12 minutes. Remember that?
I'll take it.
I love that.
That's how you got your 12
I'll
minutes.
take
Right
it. I'll
That's a
take
good
it.
compromise.
It doesn't even look like it's working anyway, which is scary, but it might. Loading.
It should just download. Can you make it
You
bigger?
can. You can download it like that. And then you want to open an actual PowerPoint.
Oh, wait.
You have like
I think
fancy.
we just-
No, it's not fancy. I just want it big.
If it's fancy, sometimes you have to
I think
download.
if you hit
Yeah,
that,
'cause this is.
You try to hit that
I
Okay,
feel
what's
like
going on?
class, 'cause everybody got these cool pictures. and
I don't.
I can't.
How do I make it bigger? Okay.
When I was in grad school, I had black and white
Um,
PowerPoint, and they looked at me
their
like,
presentation.
"What the hell is wrong with you?"
There you go.
Okay.
Everybody got these cool
All right.
Make it full screen.
I think I don't. Okay. All right, this is about bipolar disorder and other related disorders by me, Alexa. Nice to meet you guys.
Nice to meet you.
Okay, so this is going to cover bipolar disorder 1, 2, and substance/medication-induced bipolar. Also included in this that I didn't add is cyclothymic disorder, but I still can mention that because I do know about it. Okay, bipolar disorder. What is it? Bipolar disorder is a mental illness caused by unusual shifts in a person's mood, energy, and activity levels and concentration. So usually for a lot of people, you'll see like these really like great high moments and then like really low lows. Okay, so these are some signs and symptoms, which bipolar disorder 1 is characterized by manic episodes, and you have to meet the criteria of a manic episode to be diagnosed with bipolar disorder 1, which it's feeling jumpy or wired, irritable, decreased need for sleep. So you'll have some people who maybe one day wake up and they decide that they want to sell all their personal belongings and possessions, or they're going to start a new hobby activity, and it's like, it's out of character typically for that person. Flight of ideas is also really, really common. It's something you can kind of see if they're having a manic episode, just having like a simple conversation for people who are diagnosed with bipolar disorder 1. The manic episode must last at least 1 week and be present for like most of the day and nearly every day, like in that 1 week period.
That's terrible.
Okay, so for bipolar disorder 1, there's also major depressive episodes, but I think it's important to note that you do not necessarily have to meet all the criteria for having a major depressive episode to be diagnosed with bipolar disorder 1. Typically, you do have depressive episodes, which is depressed mood, diminished pleasure, significant weight loss. These are people who either are up all night or sleep all day. Like insomnia is also kind of characterized with manic episodes as well. I think that's important to add. Recurrent thoughts of death, which I feel like is very, very common when you see someone who maybe talks about their experience with bipolar and like having those thoughts of dying or like afterlife seeking questions. Okay. And then how to diagnose, and that's that manic episodes must last for at least 7 days, nearly most of the day, like present most of the time. Or you could automatically be diagnosed with bipolar disorder if you have manic symptoms that are so severe that you need to be hospitalized. Because sometimes when having manic episodes, their brain kind of tells them to do things that are not safe personally for their body, and hospitalization is sometimes the like safest route for those individuals. Usually depressive episodes occur, however, they don't have to occur, and they typically last 2 weeks. I think next in here I have just what it actually looks like in the DSM-5. So here's the actual criteria that you have to meet out of all of them. I'm actually not going to go over it because it's mostly the same exact things that I just talked about. But it's abnormally and persistently elevated, expansive or irritable mood, and abnormally or persistently increased activity or energy for a manic episode, which I feel like that's a better, more comprehensive definition. Okay, this is bipolar disorder 2. So bipolar disorder 2, you have to have hypomanic episodes. So the difference between the two is consider hypomanic episodes to be less severe than manic episodes. So it's a distinct period of abnormally and persistently elevated, expansive or irritable mood. There's this increased activity or shift in energy, and it's lasting at least 4 consecutive days, whereas in manic episodes last 7 consecutive days. Still needs to be present most of the day, nearly every day in that time frame as well. And then with bipolar disorder 2 is also major depressive episodes, which, like we talked about before, depressed mood, diminished interest, not eating, not sleeping, sleeping excessively, thoughts of death, as well as you can see suicidal ideation or actions potentially. So to be diagnosed with bipolar 2, you have to meet the criteria for having a hypomanic episode, as well as the criteria of having a major depressive episode, which I think is something that's important. And I think next I talk about the difference just between the two, because I think it can kind of be a little bit confusing. So between bipolar disorder 1 and 2, bipolar disorder 1 actually experiences manic episodes. In bipolar disorder 2, they experience hypomanic episodes, which is less duration and maybe don't happen as frequent and less severe, most oftentimes. To be diagnosed with bipolar disorder 2, you have to experience major depressive episodes, which is not necessarily the case for bipolar disorder 1. And then obviously, bipolar disorder 2, they actually experience hypomanic episodes. Okay, so treatments. Common treatments are mood stabilizers, antipsychotics, antidepressants, a combination of both, and then as well as psychotherapy, so IPSRT, which is interpersonal and social rhythm therapy, CBT, cognitive behavioral therapy, psychoeducation, and family-focused therapy. I think it's important to say that there is sometimes a specific event that can happen in someone's life that can trigger a manic or depressive episode, which can lead to kind of like a cycling for them. So sometimes, like if, for example, like you were going through a divorce, you might see like a depressive episode and then followed by a manic episode after that. Sometimes hospitalization is the best case because if it's a depressive episode, it could be suicidal ideation, going to hurt themselves or someone else. And sometimes just safer for them, especially if they're having a high level of mania and not really in control of like what they're doing with their person. Okay. So these are some psychological perspectives about kind of the cause of bipolar disorder. So I did biological, psychoanalytic, and sociocultural or social cultural. However, I do think biopsychosocial is the best psychological perspective for bipolar disorder. Biological, could be like in this perspective linked through genetics, that if someone in your family has bipolar disorder, you're more likely to have it yourself. Psychoanalytic is manic and depressive episodes are linked through one common pathway caused by some struggling grief, loss, or underlying issues from traumatic events. So that key piece in your life. Sociocultural outside stressors can lead to the manic and depressive episodes, and environmental factors such as economic status, job, or a family stressor. Biopsychosocial is honestly like the mix of all three, that yes, you can be more likely to have it because of your family, but things can be going on in your life that can kind of trigger these things. There's also the idea that there is a chemical imbalance inside the brain that kind of causes you to have manic episodes and depressive episodes as well. Okay, next is substance and medication-induced bipolar, which basically this is mania, hypomania, or a depressive episode caused by taking certain substances. Now, this isn't necessarily only like illicit substances. This can be actual medication that's prescribed by your doctor as well that you just have like an adverse effect to. So this is signs and symptoms, and this is prominent and persistent disturbance in mood that is characterized by elevated or irritable mood with or without depressed mood or diminished interest or pleasure in all or almost all activities. So it's kind of the same signs and symptoms as the other one, but this happens after using certain substances, illicit or prescribed, that these things are occurring. Yeah. I think it's also important that it can cause clinically significant distress or impairment in social, occupational, or other important areas of functioning as well. Okay, so causes and treatment. So causes can be substance use / abuse, medications, alcohol, hallucinogens, benzodiazepines, antidepressants, heart medication, blood pressure medications, prescription pain relievers, and decongestants, which I think that one's actually the most interesting that I found.
Really?
Common treatments, rehabilitation, so getting on rehab if it is an illicit substance, substance abuse treatment as well, and then possibly talking to your PCP, like your primary care physician, about changing the medication that you're currently on.
Did you read anything about how the decongestion, so like your cognitive abilities are affected by dehydration?
See, I honestly, like, I can't remember. This is a while ago. Like, I remember I read the,
That's what I would get guesses from.
so this presentation is an edited form of the last time I presented a clinical psychology project. So I can't remember. I'd have to go back through my sources and look up like specifically
There's a
why.
whole section about dehydration and how it lowers IQ as well as affects testing and cognitive ability. It would stand to reason
Yeah,
why those things are exacerbated, and decongestants are really good at lowering your hydration, basically.
I use that
Honestly?
decongestant, so it speeds up your heart rate a little bit too.
Yeah.
No, I believe it, honestly. Okay, so now this is social workers' roles in prevention and treatment. So maybe this is someone you believe to have bipolar disorder, or someone's already been diagnosed, and like, what are we able to do for this person? But obviously, it depends like what kind of setting you're working in. Because if you're a therapist, you're going to do more like counseling. Maybe you're going to recommend them to a psychiatrist to be on medication if you make that diagnosis. But being responsible for educating individuals on these mental health issues, help them make informed decisions, because not everyone wants to be medicated. And I think that sometimes we can do therapy instead of medication in certain cases. And it's nice to be able to give them the option, saying that like, this isn't the only route. Like, being on a antipsychotic isn't your only option. And I think that's really important, especially us as social workers, to give them like, here are all these different things that we can do for you and to look into. So it's accurate information about the mental health condition. I think there's a lot of misconceptions about bipolar disorder. Like, people with bipolar disorder can actually live very normal lives once they can recognize that they're experiencing an episode and help take medicine and control it, which I think can be very important. But yeah, like, you can live a very, very normal life without anyone knowing that you have bipolar disorder. And then providing information on treatments such as medication, therapy, maybe it's a lifestyle change if we're seeing that certain stressors in their lives are triggering a depressive or manic episode as well. And then provide resources for people that are in their support network. Maybe it's educating their family members about what bipolar disorder is and how you can best support this person if you believe they're going through or experiencing a manic or depressive episode as well. This is where to get help. So hospital, this is a substance abuse and mental health services administration. I have a helpline on here as well. Contacting your primary care physician, seeking out a therapist, and then just a couple of different like websites, organizations that you can go to look at other resources that they have available. So I did want.
What's the Mayo Clinic? Do you know what that is? I just like the name.
The Mayo Clinic. The Mayo Clinic is like it's like a nicely funded clinic that does a lot of advanced like research.
Okay.
Yeah, they're very good.
They're the know-it-alls.
Yeah, they really are. They have a lot of good articles on here as well.
Can you click on that where it says Mayo Clinic because it's in the US?
Maybe.
Wouldn't that be sweet? What's up next?
Oh, this is about cyclothymic disorder. This is you don't meet the criteria for a manic episode or a major depressive episode, but you experience both in that category and you cycle between the two. So it's kind of like less severe to where you can't be formally diagnosed with either, but you're still experiencing kind of symptoms that would be classified with mania or hypomania or depressive episodes.
You can request an appointment right there.
Yeah. And there's medical professionals too. I don't know where my thing
Just
is.
go back. I'm hit the back on the actual page.
Okay. I'm not very tech savvy, guys.
It like turned the page into it. Like, you should be able to go
Okay,
back to
perfect.
it.
Nice.
Okay, I think that's my last one. I think my last thing is my.
Citations.
Mm-hmm.
Now I want to click on it. Mayo Clinic.
Okay, here's my citations and my sources.
Nice. Oh, that's good.
Thanks, guys.
Sweet.
I like the
Can I get a redo? Cause that was just crazy.
I mean, you're welcome to if you
I
would
feel like
like.
miles.
I mean, you went first, so you can go again if you want.
beyond just like treatment.
That's like
Thank you.
I didn't think about that
It
at all.
just blew my stuff.
We keep making each other better. That's the whole idea. It's
We both did
She
it
got
like
resources plus the website you click on. I can make an appointment.
I'm gonna make an appointment right now. Request appointment.
Wow. like, that's crazy.
New patients. I don't even know where. I feel like they're in
Is
Cleveland,
your insurance gonna cover that?
I think
inside the U.S.
I don't think it will.
I think the closest one is Cleveland.
That procedures, are they private practice mostly, or are they like, you got pay out of pocket?
You'd be surprised. Wow, they make it like easy. Like, yes, I'm the patient. Oh, could I check my wife in?
That's fine.
You wanted to go, or anybody else presenting today? No? Have you previously received care at the Mayo Clinic? I'm not sure is one of the options.
So what's the acronym for? Like, why is it Mayo? Is it?
Oh, that's a good question.
I thought
was
that's
just
just
like,
the
is
name.
it, they call it Mayo because they're like so diverse, they can be put on anything. I think
Mayonnaise.
I think it's just Mayo.
It's just Mayo. Huh? They just like, there is no acronym. There's no meaning. Doesn't always have to be. Hey guys.
Do you want me to pull it up, or do you want to try to plug in?
I could try putting it. I don't think I'll send it to you.
Okay.
Honestly.
Or if it signs in or email, whatever is easiest. Mayo.
Put it up on your stuff or mine?
You
I don't know
could.
Google Slides.
Yeah, you could sign into Google Slides.
Mayo is a family name
Oh, okay.
by
Dr. Mayo.
two brothers who founded.
You could try to sign in there.
You got me all in his camera.
Just move it out of the way. Sit over
I
here.
think now it's.
Sit over here.
No, it's a big
But I think
corporation.
she
at this
raised
point. Makes sense.
Dr. Mayo.
Yeah.
Dr. Mayo.
Dr. Williams James Mayo.
Okay.
We have some-
Oh, look, Dr. Hobbs already replied to you.
Did you? Let me look.
Mitch. Is Alexa on the list for great minds?
What's great minds again?
Wait, what did you just say?
Do you need still great minds, man?
Is that the application?
She applied to Great Minds because you have to be within 2 years of graduation.
Is that the application you had us do? And then,
That is to apply to just social work in general.
oh,
You said
okay.
she responded?
Unless if she took you, oh, she didn't take you. That's the reply.
What does great minds offer you again?
It's like some money to do your internship in the high-need behavioral health places.
Is that the thing you were talking where they give you money if you work for them? Like for
There's
the-
also
the field?
UPP, so
Are
they
you
both,
going to respond?
and it's for Mitch.
Oh, who's that?
I don't even know.
I'm just sure this
But he must be in charge.
Was there a Mitch in the?
No, she just added me and Edison. Edison is the PI on the grant for the primary investigator.
Okay.
So the guy you just met, unless you've already met him before.
Dr. Perdomo?
Right, yeah. Have you met him before?
Yes,
Have you
it's
had him
me.
in class?
I didn't have that.
Okay, but you know who he is the PI on the grant for that $300,000.
So you're telling me I have to go buy her again?
Yes.
It seems like the best.
Come
We
on.
always have to buy.
So
it.
here,
Yeah, you gotta buy.
So did she
I
add
was
the
gonna say
Mitch to the
okay.
email chain?
And took you off.
Yeah.
Probably is she just doesn't want us to look like idiots in front of the student.
That probably is because they don't know what's going on.
No, it does. It takes a lot of work to know what's going on. Well, if you're willing to do that work.
Dr.
Oh
Perdomo.
wait, can I add a plus? Bipolar diagnosis should, it's like not better explained by like schizoaffective disorder or schizophrenia. That's usually like what it says on there.
Okay.
All these overlaps, man, it creates so many misconceptions. And if you don't do the work to understand each area thoroughly and also work with it in the real environment, you just start.
Yeah.
Oh, that's it. It's like, what? How long did you meet this person? Did you look at one paper? You had one page you read about them.
The
Other
computer that
doctors-
blew up.
Full on doctors do this. Huh?
Oh, they fixed it.
They fixed it
Oh,
and
nice.
sent
For
it back.
free.
Wow.
Yeah, the one.
Oh, because you have the warranty on it, yeah. I mean, how much you pay a year on that
Okay,
warranty?
woo-woo.
One time on Amazon, maybe $39.
Once a year, that's it?
It was one purchase for like a 2 to 4 year.
Oh, wow, that's way worth it.
That's why I
For
did.
sure.
I have my other one, but I can't find the warranty.
I see. So you didn't buy it from the actual app. Their warranties are ridiculous. You buy it from the company itself.
Macintosh.
You what? So that's bought from Mac or just?
I bought mine from Amazon. This is a used 2017 MacBook. I bought
That's
that.
better. Yeah, the brand new
The
ones from Mac are
Apple Care
ridiculous.
is like, it's super expensive and it doesn't cover a lot.
No, it's ridiculous.
Correct.
Ready?
It's yours.
Okay. Okay, so I chose schizophrenia. I chose this because I think this is a very interesting disorder to research, especially since it has no treatment. So I think it's just very interesting. So let's go on. Okay, so what is it? It's basically a mental disorder that affects people's abnormal reality. Basically, they have trouble distinguishing what's real, what's not through hallucinations, delusions, and like disordered thinking. It definitely impairs your daily functioning, but we can get into that. So the symptoms are categorized in 3 different categories: positive, negative, and cognitive. The symptoms can be seen different in different people. It progresses different in different people. Everyone's different. So to start off with the positive symptoms, in my head, I was confused when it said positive because it's like more of hallucinations, delusions, things that I would think of that I don't usually have daily. So I didn't think of it as positive, but as I did more research, they can consider it as a positive symptom. It's basically a exaggerated idea perception. So that includes hallucinations, delusions. People could think they have superpowers, somebody's out to get them, different things like that.
Which positive means the add of something, right?
Yes,
It's
yes.
a subtraction.
The symptoms can come and go. That's something I learned as I was researching this. I did not know that. Not all of them can come at the same time, and it can range between the ages of 16 and 30. And I found out that those assigned male at birth often come earlier and those assigned female. I didn't really find exactly why, but I just seen a lot of different websites said that. So now onto the we'll consider negative symptoms will be trouble with speech, lack of pleasure. Say someone does something daily, they knit or they're on their way to making something and they just completely give up. They have no desire to do it anymore. Struggling with basic daily life tasks, taking care of yourself, just keeping yourself up to par. You can notice that someone's falling off a little bit. Lack of pleasure, like I said, they can not enjoy something that they're used to doing for a long time. And a decreased desire to socialize. Say someone's very social, they usually don't want to go to events anymore. So stuff like that can be a symptom. When it comes to cognitive symptoms, those affect how a person's brain learns, stores information, uses information. They can have a hard time with memory. They might not be able to keep track of different facts at the same time as you. It can affect decision making, like I said, memory, concentration, difficulty expressing thoughts, poor learning and retention and verbal information, and then, like I said before, disorganized thinking at times. The diagnosis, to make a diagnosis, a doctor would have to perform a physical exam first, and then they would go through a review of the person's medical history, family history. They may ask them to describe if they had any experiences with the different perceptions, any concerns about achieving goals, new difficulties in life, stuff like that. To receive a diagnosis, a person must experience at least 2 of the following symptoms most of the time during 1 month period, with some level of disturbance being present for like the past 6 months. Like I said, since there is no treatment, well, there's no cure. There's treatment that can help someone still be able to go through daily life tasks without problems. The psychotic episodes that people can have, like I said, can affect their life. They could be frightening, confusing. It can be extremely disturbing to just your regular life. You could be sitting doing something that you do every single day and have an episode. I read that about 25% of people diagnosed with schizophrenia meet the criteria for depression. And that to me actually made sense when I looked up the symptoms for both. They kind of correlate in a way. The depression symptoms can occur throughout all phases of the illness, during the psychotic episodes, and then could be associated with anything after. And then treatment, there could be treatment with medication, therapy, social support groups, frequently community-based service, and hospitalization if needed, because sometimes the episodes could get a little extreme. But for most people, it is you can live with it, and if you keep taking medicine, keep doing what you have to do, going to therapy, what helps that person, as long as they keep doing that, their daily life really won't be much affected. And And then I found this video. So they have, I know y'all know service dogs usually for regular mental health disorders, but I did not actually know they had service dogs that could help people with schizophrenia. And then I came across this video. It's like 30 seconds.
What? No. Great.
Helps
So-
identify if there's hallucination.
Yeah, so I thought that was really interesting because I actually did not know they had service dogs for things
Yeah.
like that. So
That can be extremely helpful.
yes, and so I think that is the end of. Yes, it wasn't too long. Yes, that's it. And that is all. Any questions, comments, concerns? I gotta say
Fragmentation's real, man. The inner world is so fragmented, and the patients I see most are schizophrenics.
Mm-hmm.
And it's amazing how, even with that fragmentation, as a clinician, as well as us, we can develop a way of communication that validates their position, right, without confirming their delusions, but validates that what they're seeing is true. I believe you. I believe that you feel this way.
Yes.
And that somehow creates more coherent thinking and communication. I've actually seen it happen. Someone who comes in and they're like, the thing on the ground.
Yeah, everybody thinks that they're crazy.
It doesn't make any sense to you. And they'll describe things like, that thing, and they'll get mad if you don't understand what that thing is. They're describing something that makes no sense. But if you're like, no, I don't know exactly what you're talking about, but I think I do.
Yeah, instead of making us think that they're just crazy.
Instead of being like, that's not a thing.
Yeah, what are you talking about? All
And then
that.
they start to change their thinking. They're like, oh, you know what? Yeah, maybe it's something else, and they'll start to kind of think more coherent. It's very bizarre. Very bizarre.
Yeah.
But I mentioned it because I didn't think about the idea of the service dog.
When I seen it, I didn't think, because I had read it when I was researching. Then I just happened to get on TikTok one day and I had seen the video. I was like, oh my gosh, that's so crazy. I did not know they had service dogs for that.
Isn't that funny how the world kind of brings information to you when you want
Literally.
it?
That's
Good job.
impressive. Yes,
I think-
nice work.
Thank you.
Do we have anyone else presenting today or Tuesday?
Not in this class.
Tuesday. Okay, that's good. I'm saving all of those of you who presented. If you upload, see, the trick is if it's uploaded, I can put feedback while you're presenting. If you didn't upload it, then I forget to do the feedback.
I forgot to upload.
It's fine. But I'm downloading applications, so those of you who are applying to the social work
Did you
program.
see my comment on mine?
I think so.
Because you said you got my letter of recommendation.
Oh,
So I
yeah.
didn't give it.
write so many of them, but you.
They usually should.
You could just change the names and just keep.
A lot of them are even scribbled into the actual letter.
But imagine they actually read it and they're like, this sounds very repetitive.
Well, like, it's like, what do they expect me to recommend you besides not the same, like,
I don't know.
four
who-
social work professors that we have?
I'll turn
Yeah,
it into the
I mean-
sign up to present.
Because it can't just be any professor, right? It's supposed to be somebody that.
Probably the
Can
link
it just be a
after.
recommendation of your character? Because that would make sense then if they wanted to.
I don't know, but I feel like since it's related to like the
Yeah.
social work application,
Yeah.
to prove why you would be a good
But
social
you probably would
worker.
have to like take
It
a
should be-
screenshot.
Seems like it. So John, is it just a character reference that they're
Even
looking
if
for?
you put the link in the comments.
Or is
Yeah,
it
it's
like
not
social work
super
for-
complicated.
It's a character
Um,
reference, right? So it could be
Yeah.
anybody that's
I filled
interested
it
in
out,
any
and I'm
kind.
like,
So
alright.
that's good to know.
Right. And I've done them before. You can use other people too. So,
So
it's
I can
entirely-
have my nurse supervisor who's a psych nurse do it if I wanted
Yes.
to. Okay.
Yes.
That's good to know.
So, and then, because every file is different, I am downloading those of you who turned it in. I am saving it. We're boring you.
Yeah, I'm just tired.
You like that sugar drink though. I don't like the sugar drink.
That'll make you tired.
He drinks non-sugar soda. I know.
It's good.
Like what, like diet?
I used to hate them.
No, not like
the
no
low,
sugar,
low
zero
carb,
sugar.
the ones, the bubblies.
It's like those sparkling.
Oh, yeah, like
I like those.
LaCroix.
You might as well drink water.
LaCroix.
Or
Well, it
Zevia.
has flavor to it.
Have you ever
No.
seen Zevia?
I got the root beer one. It
Have you had
tastes
coffee?
like root beer.
Like the probiotic soda?
He puts coffee in his.
Yes. Well, I mix everything together.
That's nasty.
It is nasty. Have you seen Zevias? Nobody has.
Fun
I
fact.
buy these. Yeah.
I did a sweetener, so anything sweet that hits your mouth immediately triggers an insulin response, regardless of whether it's sugar or not. It's a fun fact that people don't know.
You gotta do what now?
Anything sweet that enters your mouth, period, doesn't matter if it's fake sugar or not, triggers an insulin response in your body. And the reason why you avoid sugars is because you don't want to become you don't want to be desensitized to the insulin, which it happens when you get too much of it too often. So the whole thing that we avoid for diabetes and sugar, the reason why it's threatening, the reason why people are like, don't take sugar, remember that even sweetening of any kind does the same thing. The only difference is when you absorb large amounts of sugars, not only does it trigger the response, but even later it continues because you're actually digesting sugar. So it is worse, but if you're trying to avoid diabetes, which is one of the largest killers in the entire United States and the world, you gotta cut out all sweetened drinks. So just to put it out there, or reduce it significantly.
I was gonna look at you a chocolate bar after.
See, I don't really drink pop, but
Right.
Diabetes goes up,
It's-
you're right.
it's tricky.
Diabetes goes up, and then heart disease, all kinds of stuff.
I'm for sure.
It's real.
Yeah.
I can't do
so what's the benefit of like consuming
Just limit it.
aspartame versus cane sugar?
Well, cane, like I said, cane sugar, you get the same response on the insulin, but cane sugar has your digestive system actually taken in, and there's other things that happen that are also not great for you. You know what I mean? And not to mention the fact that you crave more of it. So the cane sugar produces that addictive nature where you want more and more of it, versus the aspartame doesn't necessarily have that. It's more just, cognitive. You just like want it because it tastes good. So there are reasons why you should avoid sugar first. I always tell everybody, if you want to get the benefits of the health behind like not drinking it, but also indulge every once in a while, just limit it to like one time a day. Like pick this one day at night when you come home, I get this 120-ounce pop and I enjoy it. Not only will you get the benefits, but you'll actually enjoy that pop more than you've ever enjoyed it.
Is it a difference between drinking dark pop and light pop, or is it all kind of the same?
Yeah,
as long as it's got sugar in it, it's the same thing. As long as it's got sugar.
Can you stop that? That's disgusting. It's not funny. That's nasty.
No way.
LaCroix's
Actually,
no.
it's so
That's nasty. It's not.
I never drank it.
He does this about 3 times every time I
It's
see
way
him.
better than sugar stuff. I'm okay with that. Again, I don't drink any sweets. I literally just drink decaf coffee and water.
What's nasty
I don't drink coffee
is
and caffeine anymore. God, it makes me like a
Yeah, that's
I'm
the
already
great
alive
way.
as it is.
it comes from the skunk's butthole or something. Have you seen that?
Is it cold?
American.
It doesn't look cold.
Sometimes it is.
But the decaf regular is.
I like the bear doesn't do any good for supporting humanity because I always see, they have those good little funnel cakes and,
Oh, dude,
and the powdered Oreos, and I can't resist.
American diet is geared to
Terrible.
destroy us.
Terrible.
Right?
Terrible.
We are pushing a dishealth so that we can treat people and make them pay for it.
I just feel like
That's
I'd
the
be so
whole
big now.
economy. It's literally designed to make us sick so they can treat us and make us better.
I bought the
You gonna create
stevia
something?
cookbook for
And
that.
I'll be trying, but like I got the little powdered
One step at a
Oreos,
time.
and they was like, "Do you want to add strawberry sauce?" I said, "Of course I do."
If you bring alternative snacks with you that aren't containing that on a regular basis and always have them on hand, you're less likely to eat that. You'll eat them first. You'll be like, well, I already bought these. These are
I
my
need to do
thing.
that thing.
So just start bringing it with you. Bring protein bars that are like low in
That
sugar.
ain't gonna work for me.
This is why we're
You
like
gotta dig. You gotta dig.
That's why I have to keep my room with still gonna go get food.
Protein bars, and they aren't good for you.
No.
They're number one, they're not even high.
Wait,
They're
what's
not
that?
high.
Protein bars?
Not
gotta
every
dig.
single protein
It's
bar
very
is
little, like
good for you.
5% maybe.
Specifically, if you eat
She's
Cliff
right.
bars,
Yeah.
Cliff bars are not, they're not doing what you think.
Do you have any idea how much sugar is in
That's
a
good.
Clif bar?
Clif bars
It's
is disgusting.
ridiculous amount of sugar.
There are
You know what's a good
lot.
alternative?
Yeah.
It's venison. They make like jerky. They make venison protein bars that are just beef jerky basically that are delicious with no
Paleo.
nothing. It's just like venison.
These have like
put my
6.
arrows down.
Well, they're
What about
venison.
those?
They're like it's like jerky, but they're
I like
out of venison.
It's like deer.
It's
Delicious.
low
Don't
in
say
diet.
You said deer?
It's deer meat. Venison.
Oh, that's cool.
It's low
Deer
in
meat.
diet.
It's just dehydrated deer meat, but it's
I
about
about
six.
I eat deer burgers. That's cool.
I see the benefits. I mean,
And everybody
No
digests
sugar, no crap.
at
It's just
I
a
eat
salty,
deer
delicious
burgers.
snack.
My family weird. They eat game animals.
It's good.
They eat
Deer,
who?
deer meat's good for you.
Game.
Have you killed one with them yet?
Game
Yeah,
animals.
I got my first deer.
With a bow or a gun?
Yeah.
Okay.
So like maybe it's deer.
What
maybe it's rabbit.
city?
I can't do it.
It's actually really good. Once you get used to the difference in taste, it's.
Are you in Columbus? Okay, so in
I'm not my
I think it's a lot of.
I got family.
Well, you
That's why once I
You
see.
you can still buy it.
Grandma's
It's
from
actually
down
fine.
south. But they travel a lot, so
I don't farm.
Yeah.
Yeah.
So I want to say it was Arkansas. I think you said the cabinet in Arkansas.
Yeah.
I tried to
We
get
got
one
a
sugar
new
coffee,
coffee.
and it just didn't make me feel good. I was like,
Yeah.
Big wig, something.
Anybody else hunters?
My whole family's from Arkansas. It's Arkansas.
No, my
So they
family
eat them
likes
big
fish.
hogs and crap too?
Yeah,
Like,
my grandma eat a deer, a frog, a raccoon,
Where you
a
from again?
squirrel.
I didn't like
I'm from
frog
Detroit.
legs. I tried
Okay.
frog legs.
Oh, that makes sense.
That's crazy.
I live in Detroit and they're the same way.
What else? Squirrel, a deer, bear. My grandma cut up a bear before.
that's survivalism. I mean, if we had to go there, then
Bird.
Eat the whole thing too.
Yeah.
The bones, eat the organs, everything. You
Detroit,
just
Like,
eat
Detroit,
it
that's
up.
crazy.
is pretty. My Detroit side and my
I'm into that.
Like my auntie thought it was cool to bring goat balls to Thanksgiving.
Go balls. Oh,
Dude, those
Jesus.
are so high in nutrients.
right.
Yeah.
You gotta get used to that taste, but they're probably one of the most nutrient dense
Before I
things you
go
can
over there, like, what y'all cooking?
Yeah.
And I gotta see if she lying or not. She liked a lot.
Because later she's like, oh, do you like that? Well,
Yeah,
guess what?
yeah.
That's
That's
goat balls.
how I got the deer burger. She's like, oh,
We fed you a whole
burger.
deer
I
kid.
was
So you
bad.
know that.
There's macaroni and cheese, got regular milk, goat milk.
Goat something.
That chocolate chip Cliff Bar, 250 calories,
I like Cliff.
10 grams of sugar.
10 grams of protein,
But only 10.
17 grams of sugar.
Yeah.
That's what I
Sugar
think.
on
It's
weight.
right of the day.
It's
Man.
significant. You have to search really, really hard. I usually, when I did eat protein bars, I had to order them from Amazon because they just weren't. Even at Whole Foods, even at like the most intense places, they still didn't have a protein bar that didn't contain a bunch of bullshit.
Right.
I like Greek
I was
yogurt.
surprised.
I don't know. Greek don't have no like flavor.
Yes, it's vanilla. Okay, Boyko's 000 protein Greek yogurt.
If you get the plain and you don't like the plain, first of all, you get used to the plain
Oh,
taste.
the
It's
vanilla.
delicious. It tastes like
I
sweet.
used to like trying to buy Greek yogurt, but I just
It's in
couldn't
the
get
next
into it.
words.
I be having granola in it.
Yeah, I tried
No,
that.
no, it's a whole other thing.
Chobani? Isn't that Chobani? Isn't that?
I think they have some Greek
Yeah,
yogurt.
they're
I think they
good.
all Chobani.
I bet that granola's got a ton of sugar in it.
Now I can't eat regular.
I'm not gonna lie to you, dude.
They should never get you sharing.
Cottage cheese.
I'm gonna stop paying you attention.
I'm not a fan of
I
cottage
can't
cheese.
do cottage cheese.
I'm not a fan
Yeah, I
of
can't
cottage
do that.
cheese.
We've got our,
Development.
next, so people are presenting next week, but like we are on early childhood, so we're cruising through like growing up. Do you feed your daughter that?
Do I do what now? Why would I get that to her?
The Perdomos do, like at a young
No,
age. We wait till 6 months to give them food, even like 9.
Yeah, she's only a month and a half. I could do big cheese. How do y'all do cottage cheese?
Cottage cheese is delicious. You can also blend it if the texture is what bothers you.
I love it.
It's just, it's
I wanna
really
give
good.
it a
It's
try.
high in protein.
But-
I love that.
My
I
mom's
love
probably much of
Cottage cheese bowls, look it up.
it. It's pretty delicious.
And
Specifically top.
any assignments you guys still have to turn in, I've opened it all up. Still do it. Please do it. Anything you're missing, just do it.
I gotta do it.
Application.
Right,
How
okay.
many assignments do we have left? Are you adding any more?
The major paper that's in the
That's,
syllabus.
I want
it's
to know,
like-
before the Passover, I want to know the details on that, so I
Can
can
you
start doing
wait?
it now.
Can you add that and by like the end of next week?
Oh, you're saying,
Like add the
Well, I
Just
assignments?
add the drop-off
Paper.
assignment and just put the details
Well,
or
I
something.
just
I just
want
want
to
to
see
know the
like what it
description.
is. And I'm not saying I'm gonna.
We usually does add it like within a few weeks span because I did add something.
Well, yeah, we're in that few span, right?
Yeah, 'cause
How many
I
weeks
know
are
it's gonna
left?
take a
Three?
minute.
3 or 4 tops?
it's getting,
Yeah.
I'm
so
gonna start doing it now.
I usually do, that way it gets you moving on it. Outline or first draft.
Oh, I see. You can put it into tickets, and then slice it into some stuff.
Yeah, that way you could do like,
I ain't take English because I ain't really.
I like that.
say you do half of it and it's 2 weeks and a day. There you go. That way, so yeah, you're not waiting till the last damn minute.
Yeah, I don't want that.
Yeah, yeah.
Because I would always do that.
And I'm
And
good for it. I'm good.
I
for it
am,
till
yeah.
the last day. And
So-
somehow, some way,
Except
grind it out.
11:59, 11:58.
Man,
I think I work better in the grocery.
Me too.
I'm
That's what I
trying
do.
to-
Really?
That's my
Like,
problem.
It feels that way, doesn't it?
because if I start something and I stop it, then I'm very
I'm
unlikely to
definitely-
get
Yeah, it's like why am I doing this? I got 2
I
weeks.
still
Yeah.
got paper due. In
And
my
then I
class-
forget.
in my English class.
I just
still.
want it better for me to speed through and do it all right then and there.
That's what I call it.
Here you go. Here's your
Break it into
paper.
4 parts, and then you still get the benefit of the pressure because I have 4 days to do this much, and then after that I have another 5 days to do this much. That's the point of avoiding procrastination. It really helps.
Mm.
It'll
I
change the
try,
world
like,
if you
if
try it.
your paper's like 5
Things will get way
pages,
less
you
stressful.
can even like split it up by pages, like, okay, I'm gonna write, I'm gonna
One
write
page
one full
today.
page today.
Yep.
Well, that's what I've been trying to do, but it's like, I feel
Yeah,
like
I
I might
can't
as well
do it.
start, I might as well finish it.
Yeah,
Like, that's why I wanna come back
That
to it, or.
comes from
So y'all
practicing.
did this
That
already.
process that would help in slicing.
What that?
You can slice
The
up-
oral research report.
When you practice that procrastination and everything,
Research report
your
for
mind
what?
is geared towards that goal.
Obviously, I'm gonna use
You already
that.
did it. You did yours. You wanna do it again?
Break it out and you start
Oh, you talking
doing it,
about
it'll shape
the-
you, like,
Major mental health diagnosis.
There'll be stuff on those
Yeah.
last 2 days, like,
No quiz.
working for 10 hours.
Please don't do no quiz. I'm gonna fail your class, I promise you.
So what's the paper on?
But you
Right
just
here.
gotta practice it. You gotta be like, from now on, any project it's gonna take 2 weeks.
And then that was like Gino
Set that line, and then, and then.
So yeah, you would include that. Here's what your final paper is. If it's big enough.
You might even, because you allowed yourself the neuroplasticity and the time in between, you might actually look at it with a different perspective and understand it better.
Shoot.
It's kind of weird how it works. It's amazing. I used to be the same way.
I just try to rush to get everything done.
Is that big enough?
I'm trying to tell you, 'cause if I try to do it and then go up, I'm gonna forget about it. I tried to do it with my English paper and I still haven't touched it.
So there's the final here, and I'm gonna split screen this. That way I can paste it in while you guys.
Yeah, I just want to know these things little bits. It helps me to know the overall too, even if we're breaking it apart, because sometimes as I'm doing each part, I realize, oh wait, I don't need to keep working here. I can add this to another section and I don't have to be like too much work. Sometimes I overdo it. Most of the time I overdo it.
Yeah, it's because that way you're done. You can focus on your exams. May 1st.
There's an exam for this class.
Do we have one in here?
No.
This is your final,
Lord, the Lord is here.
and also with you.
Exams are stupid. To be honest, there's no proof that they actually help increase comprehension in any way. If anything, they only test memorization, which memorization is the
agree.
worst tool for learning.
At every
It's a terrible tool for learning.
game there is.
Look at North Korea. So the Philippines, the Philippines are almost 100% memorization, and the testing rates in correlation with the IQs is like atrocious. Like basically,
funny,
the only
though.
people who test well in that country are ones who have good memory, and those people aren't the ones who actually are the smartest ones that go on to do real good things in the world. So it shows you how bad memorization is.
My memory is, if it's not on my phone, if it's not, it wasn't willing to learn.
So here's your ethnographic study of one's family of origin. So you are going back to your like genogram, eco map, all that. So each student will write a case report about your family. It's like 6 pages. Have your citations. Students study and cite relevant literature. What's that?
Casually 6 pages.
I didn't.
Casually 6 pages.
Well, that's why
Good 3.
you'll do the first half, do next month, a few pages for next month. You do a few pages for the end.
I got why do y'all make us write these 6-page papers?
Because in social work, all you do is paperwork. That's all you do. All you do is write about.
But this is a question for you, and nobody can hear. Do you read them like?
I do actually. I
You
do.
go through every one.
I mean, yes,
and
I
you sit
do.
there and just read.
I do.
You're a special specimen, Mike.
I'm not.
Because
I'd like to think most of the teachers read through the papers, even if they haven't auto-read to them. I mean, I feel
Yeah.
like I get the feedback I get from my papers, even that are like 10, 12 pages, are thorough enough where.
No, I just have some freshers who don't read it at all. It's more
Really?
that they saw that I submitted something, they scrolled through it to see that it was something that was actually written
And then
in a
just done.
document.
Yeah.
I like feedback. I can't see
I
it.
pages so calm.
Yeah.
right, that's why I said
I must still be in like a high school mindset, because I feel like 5 is like the minimum that should be cool.
you mean the maximum.
Oh, my bad, maximum.
Yeah. Because in grad school, 5 will be the minimum, and that's for your MSW.
They go
The
get
max will be what, 20 something?
The most I've
There's gonna be a lot more pages. They're trying to prepare you. We gotta do it now, otherwise you're not gonna be ready.
What am I writing all these pages?
Well, so okay. So think about this. Write a paper. We'll highlight while I'm reading it too for you. Write a paper reviewing your family experiences. Use your eco map and culturegram. Your paper should address significant issues in your life and your family experience. The effects these issues had on you and other family members. Issues could be addressed include sexuality, drugs, peer pressure, body image, family dynamics, How did issues of diversity affect you? I do hate that that's weird, but show how theories can be used to explain your behavior. Here's some examples. So here's a theory, psychodynamic, or if you want to use psychosocial, social learning theory. The most often I used from my doctoral program was actually ecological theory, which was the very first PowerPoint we had on ecological theory as a holistic theory of how we're influenced in life.
So they are practically evaluating us, making us evaluate ourselves.
Yes, it will be kept confidential, like it's not going on blast.
Well, I know, but it's like,
That should make it easier.
interesting.
Yeah, that's why it's probably gonna be easy because it's about you.
Right. The idea is you're writing a paper about you, your upbringing, the neighborhood you came from, if you had too many rich friends, if you had too many poor friends, if you had a rich neighborhood, if you had a crazy high school, if you had a school shooting, if you had too many drugs at your school, if you know, there's a lot of shit.
If you write about you, it should be real easy to feel that.
So we're
It's about
using
you.
the theories to explain
hard.
why this may have occurred. Like for example,
Yeah.
my anxiety, I maybe use like, well, my mom has anxiety.
Yeah, that can
Like,
certainly,
it
yep.
explains-
Yeah, because here's, for example, you may want to discuss how social learning theory, your involvement with certain friends, but the one you said is fine. Any example you want. This is the one we use in the doctoral counseling program. The ecological theory is by Yuri Brofenbrenner. So it's I didn't even get theory until I was like past graduate school. I used to get annoyed when they talk about theories because it didn't make sense. But as you work in the field, when you get your internship, and for me, I didn't have internships in undergrad like you guys. I had my internships at the end of my graduate school. So that's when it started to make sense.
That's cool.
Tracy
You're gonna
replied
put
to
this in
you.
there, right? You're gonna put this in the,
Oh, yes. That I think it's already on the final paper one.
Okay.
Correct. It should be.
Yes, please, thank you.
I'm gonna-
We all have too many emails all the time. That's why. So it's on this one, but yeah. And this is how we break it up. So you got next month, this is due, next month, that one's due, right?
Nice.
And that's all.
Easy peasy. Okay.
Maybe you need to give your learning techniques to other teachers, because this is why I have a grade in this class.
I am not a good example of life in general.
This is an easy class.
Maybe
That's
you
a very
should
easy
give
class.
maybe you should give your
To attest to
amazing
that. It's a very easy class. Not that I don't appreciate it. I really, and not to say that if you do those assignments fully and actually engage best you can, that they don't teach you exactly what's intended. That being said, this is the easiest class I've had out of any class.
Every social work class I've had is easy
Mhm. They are.
if you like show up and like you say, engage.
Engage.
Right.